Eliminate hand veins, forearm veins, and foot veins with foam sclerotherapy. I'll tell you all about it on this episode of the Becky and Boca Show. I am in Tampa, Florida, visiting Dr. Christopher Pittman, Interventional Radiologist at Vein 911. People come from all over the state, the country, and the world to see Dr. Pittman because he is a renowned expert of vein treatment and removal using foam sclerotherapy injections.
Becky chronicled her experience about 8 years ago. She had a wonderful result. She only had one treatment, which is uncommon. So you're going to get all of that stuff. This side's clearly worse than this side. And we're going to get a few of these forearm veins as well. So Becky was asking about this stuff. Most people don't like them and they already have vein disease, like you in this case. And when they get to a point where it's kind of more than just the arch vein, then I'm like, okay, sure, we can get rid of those. It's no big deal. You know, a normal weighted person, you're going to see the great saphenous vein, okay, right there. That's the longest vein in the body. It goes all the way up here, and it comes down here, and it makes a loop, and it communicates with the small saphenous vein back there. And you're going to see the great saphenous vein right in front of the ankle. We all have it. What's different about getting rid of veins in the feet, if it's just cosmetic, is they're under pressure. So going right into someone who just doesn't like their feet veins, it's not advisable because you have to get rid of all the stuff up above. So we're going to have to start higher up. You just don't want to close those off because legs are under pressure, hands are not. Number one, we need a map. We haven't done an ultrasound on you in quite some time, and I'll bet Sarah has some time to do one. Yeah. So we could have Sarah go and do your map.
So I got my ultrasound mapping of my legs and we were ready to proceed.
So this is the same thing most doctors would use on spider veins when
Correct. It's a soap. It's a detergent sclerosant. It's approved for spider veins when we inject this liquid, but the liquid is consumed so quickly by your blood that it won't work in a larger vein.
Oh, okay.
So in order to make it work in a larger vein and become more powerful, we mix it with room air or sometimes physiologic gas like oxygen or carbon dioxide. If you make a foam out of it, and you can't even see the bubbles in there, okay? It's like cappuccino cream or shaving cream. And it pushes the blood out of the way, and so then it acts undiluted on the vein wall. So it's much more powerful as a foam.
One of the things people are always worried about is they think they need these veins. So do you want to address that, Dr. Pittman?
Well, first of all, if you have a vein issue in a hospital, they call an interventional radiologist like me. And I've never put an emergency IV in a wrist or hand. I've just never done it. Not gonna. We're gonna put it in the neck vein, the arm vein, up here. If you're ejected from a vehicle, they're gonna put a tibial bolt into your tibia. They don't even need an IV anymore.
Wow.
So you're gonna be just fine with your hand veins. I mean, I really, it's just, and
So
it's way less.
I would never be in a
issue.
situation, an emergency situation, where they couldn't find a vein.
Never. 20% of people, you just can't find a hand vein. I mean, there's just, they'll be in the ER, whatever. You just never find it. They're not dying.
I know this is a very unique procedure. How many doctors actually do this?
Of the vein doctors out there, I would say probably less than 5% would do it. Probably even less than that. Yeah, if you're gonna have this done, you really want it by someone who's done a lot. We've done a lot of redos, people who've had them done elsewhere, but always ask your practitioner. I don't care if you're having major surgery or anything, How many have you done? How often do you do them? There's no substitute for experience in medicine. A lot of the folks who do hand veins aren't going to treat anywhere in this area, and they're certainly not going to treat a finger vein, but we will do that in here based on, what we see and what's going on. Let's do this. Let's put this hand like this and just hold it up. And if you feel like this is starting to swell, again, loosen it up, okay?
Now over to the left hand and forearm. You can actually see the foam going into the vein.
Let's bring this arm up.
All done with the left arm.
So Remember, this will look 70 to 90% better overnight, and then it'll take a few months for every little vein to go away.
Now onto the feet.
And so we can get rid of feet veins if they're bothering people. Look at that. See, there's 25-year-old feet under that. Becky's had medical treatment, which you really need to do that before you tackle these. So a lot of people will present with a bunch of spider veins here and want us to get rid of them, and it's really a sign of medical vein disease. And we have to deal with that first, because if you don't deal with the leak in the attic and you try to get rid of the flood in the basement, it's not going to work. Okay?
The sides of the heels, like what you're doing right now, I think is really important, because we have all these little veins there, and we just get this kind of stained look. It just kind of looks dirty, but it doesn't wash off. And that big vein on the top of my right foot was the worst. And that is it. He is done.
Okay, how long do I leave these on?
I generally say overnight.
Will I see results right away when I take this off?
70-90% better overnight. But even if we killed every vein that you have, inevitably some will collect blood, and it'll look like, well, they missed that one.
Yeah.
They didn't do anything, but it's actually dead. We don't have to see you back in 3 weeks. Again, for people who come from far away, there's other ways to deal with this, but ideally, probably about 3 to 4 weeks, and we will pop any of them that have blood in it, so you'll look better quicker. If we never did it, the body will still absorb it. I have noticed over the years that people who drive the furthest to see us
I did that,
look
yeah.
the best.
Because people come here
quickest.
from Miami and South Florida.
Atlanta, Ontario, these ladies are driving
Driving,
12
yeah.
hours. But I always say it because it's just funny to me, but it's not that everyone will look great.
Because
but
they hold that
it just drains the blood out. I said,
Okay,
if you
so
want
what
to
is
drive
the-
to Miami or Boca, today's the day. And then if you have any problems, get me. If there's going to be anything, rarely people get a little swelling in the fingers, sometimes the back of the hand. And then at that next visit, if you have any little ones that we want to get, we'll get.
When I left, I had my wrists and hands wrapped like this, but I went out that night. I just threw on one of these little jackets with the thumb hooks, and nobody could see the bandages. I went about my normal routine. No pain really, just a little aching and maybe tenderness and swelling.
It is about 2.5 weeks past the procedure. I did get a little touch-up the other day, and I just want to show you the difference. This was that huge vein, and you can still kind of see it, but it is blocked off now.
And this is what it looked like before. It's almost hard to believe. Now both my forearms look so much better.
And all the way down into the fingers, my other wrist, and I will show you my feet. Remember, there was just this big cluster of veins here, and there was something going on here down by the toe.
This is what it looked like before. Oh my gosh. And here it is now.
You can still see some of the veins because they are dead, and that'll take a while to completely go away, but already it's quite an improvement. I'll show you the other one. So I am very happy with the procedure. Okay, everybody, thanks for joining me on this episode of the Becky and Boca Show. See you next week.